everybody, I'm Karen with a C. I got it right this time. Chinese medicine and acupuncture are not always taken seriously within Western culture when compared to Western medicine. There is often doubt about its credibility and effectiveness, often being compared to other practices such as witchcraft or healing crystals. It's not surprising that this is the case when you look at the origins of where Chinese medicine came from. It comes from a time in ancient China, a time of scientific ignorance, when people believed in ghosts, demons, and qi energy. Western medicine, on the other hand, is founded on science and research. This is the modern standard, and the same expectations are put on Chinese medicine. Yes, there are some aspects of Chinese medicine that are based on superstition. But does this mean that it is ineffective or doesn't work? The fact is that Chinese medicine was developed over many thousand years, and it was developed through trial and error. They figured out that certain things worked for treating various conditions. They didn't understand why, but came up with their own theory for why it worked. Of course, the theories that we came up with were almost always at best a guess based on superstitious belief such as qi energy and meridians. This is why Western culture has a hard time accepting Chinese medicine. But is this really relevant? Are we focusing on the right thing? Is it more relevant that the theory of Chinese medicine is not founded in scientific fact? Or is it more relevant that it works? Because Chinese medicine does work. This is the reason that we have been using it for thousands of years and are still using it today all around the world. The fact that it works now is also supported by modern research. The reason why it works is not yet fully understood, but can be explained to some degree with modern science. I specialize in acupuncture, which is one part of Chinese medicine. So today in this video, I will be showing you how the theory behind acupuncture and modern medicine are actually more similar than you would think. Acupuncture works, and modern science has helped us to explain the real reasons behind why. Science now knows that acupuncture works because it's stimulating the nervous system. Ancient Chinese practitioners figured out the neural pathway within the body that they called meridians, and also figured out the best places to access it, which they called acupoints, due to the higher concentration of connective tissues and nerve endings in these locations. Depending on how you stimulate the nervous system, you can encourage healing and pain relief, as well as other desired effects. Qi energy described as a flow of energy similar to our understanding of the electrical signal throughout our body and nervous system. Yin and Yang describes the balance of this energy, how it makes you feel, and is used as a way for Chinese medicine practitioners to diagnose and treat. A pioneered discovery in modern acupuncture research is that acupuncture stimulates the secretion of endogenous opioid endorphin. The significance of this discovery is that it established the neural model of the acupuncture mechanism. If acupuncture stimulation generates a nerve signal to the brain resulting in secretion of endorphins, it may also result in the activation of other neural pathways, as well as the secretion of other neurotransmitters. Much research has been done on the neural mechanism of acupuncture since then. One is called local effect. It is easy to understand just as how it sounds. The effect acupuncture insertion does to local parts of the body is most commonly seen in the treatment of musculoskeletal and local nerve conditions. This micro-injury essence of the acupuncture mechanism, based on research, can increase local blood flow, accelerate metabolism, facilitate healing, and pain relief. It stimulates the nerves in the local tissues, which causes the release of neuropeptides, resulting in dilation of vessels and increased circulation. Acupuncture may also have a pain relief effect through the release of encephalin and the relief of muscle shortening. Another is called the distal systemic effect. Acupuncture may also affect the level of other neurotransmitters in the brain, related to the pain-modulating, emotional behavior, drive, and appetite. Moreover, an influence that acupuncture has is on the somato-autonomic reflex. By stimulating the skin and tissues, you change the autonomic nervous system's function. It has been reported that certain acupuncture points overlying a deep nerve send strong afferent input to the sympathetic neurons in the medulla. Clinically, this may account for its effect on some gastrointestinal disorders, respiratory issues, and cardiovascular function. Apart from this, acupuncture also has been proven to relate to the neuroendocrine effect, which is associated with our hormones. As you can see, acupuncture is not a form of witchcraft or a placebo. Science is now starting to understand why it works. Thank you for watching. If you think this video helps you, please give me a like, comment, share, and follow. I'm Karen with a C.